Morning, everyone. I often say there's so much going on, nobody could possibly cover it all. There's so much happening, you can't keep up. It's not possible. And this meme here explains it very, very well. Death of the West by 1,000 cuts, right? Social constructivism, postmodernism, radical feminism, cultural and moral relativism, echo chambers void of intellectual diversity, cultures of perpetual offense and victimhood, identity politics coupled with progressive self-flagellation. Self-flagellation is when you hate yourself. Political correctness. Did I say social constructivism already? Yeah, so it's just so much stuff. And I think, I don't know that he's even covered them all, right? I don't even know that he's anti-racism would be another one, attacking the West, right? Death of the West by 1,000 cuts. So there's some more that he could add to the squares here. But regardless, he's got his finger on the pulse there, and that's really what's going on. Man, I changed browsers because my other browser was driving me so crazy about closing my tabs on me, and it's doing the same thing. I may have to disable some tabs. Anyway, regardless, here is me yesterday. Somebody sent me this picture, effective mask policy. Members and guests must wear a face mask that covers their mouth and nose at all times. Individuals who are unable to wear a face mask due to medical condition must wear a face shield. Children under 2 are exempt. Well, isn't that interesting? Because in the Section 22 order, it specifically states a person shall be exempt from wearing a face covering on the premises if the person is a child under the age of 2. Okay. B, wearing a face covering would inhibit the person's ability to breathe in any way. C, for any other medical reason, the person cannot safely wear a face covering such as, but not limited to, respiratory disease, cognitive difficulties in hearing or processing information. Or D, the obligation to provide reasonable accommodation under the Ontario Human Rights Code requires exemption from this requirement. So interesting, Costco. You're in direct violation of the Section 22 order. I'll be speaking to the manager. Yes, I will. And you know what's interesting? Here's the rights of patients. And if Costco wants to mandate a medical treatment, they become a doctor or somebody offering medical advice, and I become a patient, and I have the right to refuse. I have the right to refuse. You have the right to give or refuse consent for any procedure and for any reason. You do. Welcome to your rights in Canada. Okay, here's Ontario specific, and this is Canadian Health Advocates. So these people they're doing a blog. They get paid by people connecting them for help with litigating this stuff. But patients in Canada have the right to the following. People in Canada have the right to the following: to be treated with dignity and respect, to refuse consent to any proposed treatment, to receive information relating to any proposed treatment and options. You are supposed to be informed, okay? In Ontario specifically, you have the right to give or refuse consent for any procedure and for any reason. Yeah, and the Human Rights Code say that the exemptions must be in line, and they have to serve you, okay? So they can say that. They can say, our rules say, and we're going to call the police, but you could calmly say to the police, here's the clearly written exemption into the order. I'm abiding by the law. I have an agreement with these Costco people. My membership never said anything about wearing a mask, and them arbitrarily making rules doesn't hold water. Rules that go against the human rights, right? Like the Human Rights Code. And I was saying that there's charter violations. The reason I was saying that, here's the right to refuse treatment, recent Canadian developments. This talks about the right to refuse treatment and regarding charter recent litigation because of the update of the Charter of Rights and Freedoms in 1981. It changed the way things were interpreted a little bit. A lot, okay? But you have to have informed consent, right? For consent to treatment to be considered valid, it must be informed consent. The patient must have been given an adequate explanation about the nature of the proposed investigation or treatment and its anticipated outcome, as well as the significant risks involved and alternatives available. The information must be such as will allow the patient to reach an informed decision. In situations where the patient is not medically capable, the discussion must take place with a substitute decision maker. Have you had a discussion with even the government about the possible risks of masks? No, right? Informed consent is required. And I know that I'm banging the drum on this pretty hard, but having corporations make de facto laws claiming you're coming into my private business and so you must do this. This was litigated in the 60s, right? You can't just refuse service, especially somebody who's accessing an exemption under the human rights laws, human rights umbrella, okay? So And the other part of this is the informed consent, is the medical nature of the intervention, the lack of informed consent in the public, the lack of the lack of the even discussion of the potential harm of masks, right? And I'm not going to go too deep in the harm of masks. There is potential harm in wearing masks, but I'm just talking about consent and your ability to refuse. Okay, this is important, right? And I'm not going to read all this stuff necessarily here, but here's why I think that there's a charter connection. It wasn't the Morgentaler ruling, the 1988 ruling Morgentaler case that the Supreme Court of Canada said that abortion law violated Section 7 of the Charter of Rights and Freedoms. That decision struck down Section 251, which criminalized abortion, killing a baby, right? I think that it's interesting. Here's number 7. Everyone has the right to life, liberty, and security of the person, and the right to not be deprived thereof, except in accordance with the principles of fundamental justice. Okay, so you have a right to be free, liberty, right? And to refuse medical treatments in Canada. And so you have such a right that you can refuse to carry a baby to term to live out your life, liberty, and security of the person. Does that not extend to masks? We're talking life and death of another individual here, right? Like, that is how seriously we take Section 7 in Canada, right? The 1988 Morgentaler. It hasn't ever been questioned, right? Parliament has not found the will since then to even bring this up. It's a very, very fraught issue in Canada. It's so fraught, we are willing to turn a blind eye to the enabled death of another human, and it is another human, to maintain that, that ideal, right? That you have the right to life, liberty, and security of the person all the way up to that point, right? To carry out an abortion. But you don't have the right to refuse a mask to go to Costco? I don't know, Costco. You might have some pushback on that. You've got some from me. Okay, Justin Trudeau has decreed that Christmas is on the line. Christmas is on the line if you people don't smarten up, right? If you don't, it depends on what you do. Trudeau says holiday gatherings are on the line unless people act now. Here's the thing, though. And I'll bring this over here. The thing is, when you... Okay, no, I'll get the other tab. Hold on. When you spread doom, gloom, and disaster, oh my goodness, the world is ending, Chicken Little, right? When you do that, and then people can look and say there's one person in the hospital in the whole Wellington Dufferin public unit, and you're threatening, and you've locked down a Mennonite community for not complying, one, and two, you're like the doom and gloom. They want lockdown. They want complete and utter lockdown, and they're saying if you don't act now, we've got one person in the hospital. If you don't get that better, if you don't make that better, we've got 100 active cases and 10 new confirmed. Okay. If that's 100 active cases per one in the hospital, I mean, hey, that's in the whole region. City of Guelph has, I think it's 30, right? 37 active cases, one in the hospital. So if you don't smarten up those 37 cases, we're not having Christmas. We're canceling Christmas. You better smarten up, says Justin Trudeau. This is laughable. People are not going to pay attention to this, right? Action needs to be taken immediately to preserve any chance Canadians will be able to gather over the holidays, even in a restrained way. So that means further authoritarian lockdowns, right? Further lack of ability to assess my own risk and to decide about my own, my own agency, my own death, if it comes to that, right? And even looking at the consent and informed consent stuff, I did highlight this, but it stopped being highlighted. But you have the right, all the way up to if it will lead to your early death, right? Like, you have the right to make that choice. And taking away people's chance to celebrate Christmas because there's outbreaks in some old folks' homes. Maybe we should be protecting the old folks' homes. Maybe we should be refocusing the enforcement and all that other stuff that is on private citizens at this point in time to focus on protecting and helping people in old folks' homes, and not locking them down and being inhumane about that, but like actually helping them, right? Actually helping them, and maybe letting the economy get back to started again, right? I don't know. Maybe that would be a better use of our time. Here it is. Under the law in Ontario, an adult patient who is mentally competent normally has the sole right to refuse or consent to any health care treatment, even if refusal increases the seriousness of the illness or the possibility of death. So, I mean, it's very, very interesting that we're at the point where Justin Trudeau is threatening no more Christmas for you, right? Well, cancel it. Just cancel it. Very interesting as well, the complete total disappearance of the flu. The flu is gone. Here is, Kelly back in October was talking about October 16th. She said, what if the flu had decreased by 98% since April, right? And yeah, 98% since April. So 2019 flu, you can see the numbers. And 2020 flu, you can see the numbers. 2019, in the first week, there were 2,169 cases. And in 2020, there was 1,900. Since week 10, usually 34,000 cases in 2019. And that's that's not average over the 6 years, but that's in line with what the average would be over 6 years. And then 2020 flu, 2,000 cases. And then since week 15, usually 32,741 and 374, right? That's crazy. A complete disappearance of the flu. Here's another, this guy replied and he says, can confirm, here are Canada's numbers, 12 cases in 9 weeks, despite testing twice as much. A 98% decrease, which seems like a statistical anomaly, right? It's crazy. They're testing. So what I thought was happening is, and this was wrong, but this is what I thought was happening, is that they were testing for COVID, and they would test you for COVID, and you get the positive result, and then they wouldn't test you for flu. But that was wrong. They're testing for flu. They're actually testing at 2.2 times the average for this week over the past 6 seasons, right? They did 9,000 tests, and the positive for influenza in week 44 was 0.07 compared to 3.7 during the past 6 seasons, right? To date this season, 12 flu detections have been reported, which is significantly lower than the past 6 seasons, where on an average of 592 influenza detections were reported between weeks 35 and 44. Why are people shouting this from the rooftops? Like, the flu has been a killer of humans for a very long time. COVID-19 killed the flu? Is the flu? I have no idea what to make of this, but they're testing for the flu. They're not finding the flu. I don't know, but it's very, very strange. There is a link to this in this email chain. I'll probably try and find it, but if I don't find it, it's in this email chain. I said, hey, do you have a link? And he linked back to me here. Or you can, it's, I don't know, maybe 2 layers. Doesn't matter. I'm going to move on. 68 deaths in Nova Scotia in 2018-19 season, 9 in 2019-2020. We are being played. And again, I say, I don't know what happened. I don't know if the flu's just gone, right? Like, poof, disappeared, right? And COVID-19 just ate it, or what? I don't know, but not there. Here's Dr. Kaur, and I use her tweets a lot. She's very interesting. She says, fascinating preprint study on SARS-CoV-2 immunity in Italy. T-cell testing identified 97% of confirmed COVID-19 cases, where IgG antibody immunity testing only identified 77. So she's talking about a new test. And she talks about here, 12 big pharma companies, each worth $35 billion, had 22 academic HC offices on their boards, med school deans, hospital presidents, hospital directors, department chairs, division chiefs, high-level leaders. Average package, $475,000, company stock, $1.7 million. Who knows what motivates people, but isn't cracking down on a Mennonite community for not obeying with contact tracing or getting tested when ordered? Isn't that weird when you have a right to refuse any medical treatment in Ontario for any reason? And even if that means your early death? Isn't that odd? You have to get tested. You're sick. Get tested or we're going to fine you. Weird. Interesting, isn't it? The iron lung thing. Okay, this person said, LOL, they had an iron lung around seniors back in the spring. They did. It was, here's April. Oh, okay, hold on. Here's Ontario. This is the article. Ontario building iron lung. But back in April, they had, these tabs are out of order. Okay, here's the April one, right? Ford moves to fortify iron ring of protection. It's not working so well, right? And here's September 29th. Coronavirus, Ontario tightens iron ring around long-term healthcare. So they've been talking about this since April, and then September, they're iron lung. We're gonna do this, or iron ring. Rah, rah, rah. I don't know if that's supposed to be like some rallying cry. It sounds propaganda-y. But then Miss Elliott says, at a news conference Friday, Health Minister Christine Elliott said over the past week alone, the province has seen 71 deaths in long-term care homes. So I did a bit of math, and I looked at the here's the COVID deaths. And there's some points I want to make here, so apologies if I'm taking too long. But I looked at all the deaths, so I added all of these up from the last week, and I did yesterday 7 days. So 1, 2, 3, 4, 5, 6, 7. So that should be the last 7 days. That equals 103 when you add that all up. 19, 18, 15, 15, 12, 13, 11, 103. So 71 of those were long-term care. And you've been building an iron ring of protection since April? What have you been doing? What in the world? Like, okay, I've got a better chance of protecting my loved one if by giving them a wheelchair and, like a gun and just sending them off down the street. Like, find an isolation center, like, it's crazy. Here's the hospitalizations in the first wave, okay? Massive hospitalizations, thousands of people in the hospital, okay? This is May 9th, 1,000 people in the hospital. It started to back off May 24th when we had 878. And then by June 7th, we had 635, and we haven't seen those numbers again. Despite mass testing, we've got 400 people in the hospital right now, and we're locking people down. How many tests? Oh, look at all these tests. Look at all these tests. New cases. The cases aren't resulting in deaths, and they're not resulting in hospitalizations, and we're locking people down and shutting down businesses for nothing. It's absolutely abhorrent. And the Mennonite communities, don't get me started on the Mennonite communities, please. Unbelievable. I heard that the Mennonite pastor from will be speaking today in St. Thomas. I hope he does an excellent job. Good. I'm glad that he's coming out. This is unbelievable. And I wish I could make it down. I was trying to figure it out, but it doesn't look like it's going to happen today. Sorry, guys. But man, it's incredible what's going on. It's incredible. Officials, and this is what's going on. Okay, officials beg Torontonians to stop socializing with those not in their households, including outdoors. They want to shut down everything. I was going to highlight this, but this is they want to shut down everything. My message when it comes to COVID-19 is very blunt and simple. Stay home, says Toronto Mayor. Outdoor dining? Yes. In November? You moron. With friends rather than family members that you live with? No, said Davila. Get bent. Get bent. Look at this. Look at the data. Stop telling me about models and look at what has happened. These liars. These absolute craven liars. Colin DeMello is reporting, this made me so angry yesterday. Ontario and the red zones are being asked to limit your trips outside of your households except for essential reasons, going to work, school, groceries, medical appointment, exercise. Papers, please. We're at papers, please already. Okay? Did you miss it? Because here we are. We're there. We're at the point where Costco is making laws. You have to wear the mask here. Sorry about your luck. Despite human rights, despite charter rights, despite all of the connections that I was making earlier. I'll not rehash it. But you don't have the right to even fight it. You can't fight it. Sorry, we're not recognizing your exemption. We're not recognizing your basic human rights. Don't shop at our store, I guess. Thanks, bye. Wow. And people are behind this, the whole don't shop at the store. It's a private club. They get to decide. Okay, I'll make a private club or two. And the intention is not to limit people who are of a certain race or creed or anything like that. But if you're woke, you're not welcome. Back to this. You notice how all the Ontario PC MPPs have been told to wear a mask in their profile pictures. Indoctrination, everyone. We are there. And they're using tax dollars to build the gulags. Randy Hillier says, Carleton Place Town Council seeks to enact right of entry into private dwelling laws. Police do not even have that level of arbitrary force without a warrant. COVID has become an authoritarian tool. We're way past authoritarian tool. They just built, it's self-imposed walls. Right? If you leave, your neighbors are going to rat you out. I don't think they live together. They're having a walk. They're walking outside together. I don't think they live together. Get them. What do you think is going to happen? Do you think people are just going to comply? There's going to be the Karens out there. There's going to be those snitches, right? Unbelievable. A boy dies 3 times in 3 countries from what? Difficult to guess? No. Not difficult either. Portugal, Belgium, and the UK published the lie. So this one's Belgium. This one's Portugal. This one's UK. This guy's Ishmael Mohammed Abdullah, and he's from Brixton, yeah. And I don't think he's got the same name here, and he's got I didn't see the article on this one, but he's got a different name on the left one, and I'm terrible with names anyway, so I'm not going to mention it, but unbelievable. The other thing we'll hear is, it's better to save one life than it is to have somebody die of COVID-19, and the thing is, people are dying anyway. If COVID-19 wasn't going to get a lot of these people, the long-term care home people, they were gonna die anyway. With the regular burn rate on a long-term care home, I've been hearing from people. I talked to my mom about it, and she said, "Well, yeah, I mean, people die." And people have been emailing me saying, "Yes, people die." I've heard from people in a couple of nursing homes, and they said that they've stopped being tested regularly. They do one every couple of weeks. So make of that what you will. Each test costs $42, right? And 36,707 tests whichever day had that one, that was about $1.5 million. Right? So like your tax dollars at work, everyone, to test healthy people, to make sure that they're not sick from a virus that kills very few people, right? And Lori Goldstein says, false comparison, people will die no matter what we do. They're not just dying from COVID-19. They're dying from delayed heart surgeries, delayed cancer detection, rising opiate deaths, depression, suicide, and domestic abuse rather than rates because of lockdowns. There's no simple solution. There is a simple solution. Look at the data and stop listening to the stupid models. Look at the history and not projections, because the projections are a lie. Pierre Poilievre says, liberals twisting and turning into trying to explain why Canada's jobless rate is so much worse than peers. Latest excuse, U.S. calculates unemployment differently. Fine, line up the methods, apples to apples. Canada's October unemployment rate is still higher. We're still worse than the G7 and most expensive, and they want to lock us down further. And do you think that there are going to be businesses that will be able to withstand this? No, I don't know that there are households that will be able to withstand this. This is unbelievable. This is an attack on everyone who lives here just because we live here. And it's just not appropriate. We've got Premier Kenny saying Alberta has suffered an economic collapse in the middle of the worst financial crisis ever. So that's pretty fun. And just to make sure you understand how serious that Aaron O'Toole is taking this, he says, I understand my press secretary has reached out to Judah Genius to see if he would be willing to interview me. Stay tuned. Or interview me next. Stay tuned. And that's apparently Garnet Genius's son. And, eye on the ball there, Aaron O'Toole. There's a reason that nobody trusts you. I mean, right now is not really... There's a whole lot going on. You could maybe mention Costco. You could maybe talk about the disaster Canada's finding itself in. You could talk about globalist infiltration. You could talk about China. There's a lot you could talk about. And the reason that nobody cares about what you're saying is right here. Right here. Or that I don't care. I mean, other people might care, but I really don't care. Really don't. Oh, look at that. 160 likes. Swing and a miss. Ooh, ouch. Why do I keep making baseball references? I don't like baseball. Anyway, Charlie Angus says liberals are now arguing about underwear as a part of their 33-hour filibuster to stop investigation into the WE scandal. Underwear. I kid you not. This is a distraction. And then they talk about they're not even fighting about underwear. They're talking about who started the underwear thing. And it doesn't even really matter because it's all a distraction, because as long as you're talking about underwear, you're not talking about what matters, right? And so fall for the trap, I guess, if you want to, but it's bullshit and it's a trap. And I don't care about underwear. We can focus on who said it or whatever, but maybe get the WE documents and just have a vote. Just keep having votes. They can sit there and talk, have a vote, and then just wait for them to vote and vote and vote and vote. I mean, and then bring down the government, right? But that's not going to happen because the NDP is led by Jagmeet Singh, who's just a backbenching liberal, right? Yep. Here's Kyle Becker, and he says, Dominion security systems security vulnerabilities have been called nothing more than conservative prattle. Well, here's Dominion itself admitting to medium and high risk in its user manual. Its recommended remedy? Invalidation of the election. Yeah, I mean, just invalidate the election. No problem. Easy. Done. Busted, says Patrick Howley. I have evidence showing Dominion voting system is headquartered on the same floor as Soros-funded Tides Canada Foundation. Tides created the Black Lives Matter Support Fund. Dominion partnered with Soros's board member and good friend. And there's a whole deep dive you can do on your own. I'm not going to go into it. But these are interesting connections. These are interesting things. The Dominion voting system is certainly questionable. I think they just gave Pennsylvania to Trump because of 700,000 invalidated ballots. Same is happening in Georgia. I think they're doing a hand recount in Georgia, but they're having problems with certain things. But the Dominion ballots have been switching it over in a way that is hard to detect, right? Like 3%, right? Making sure that votes are distributed evenly and make sure that it's not if upon examination it looks legit because it's not like a crazy runaway for Biden, let's just say, right? But on closer examination, if you put it on a scatter plot, everybody who looks at the data goes, oh, that's an algorithm. Isn't that interesting? 2019 election fraught with unregistered voters, difficulty proving ID, Elections Canada says. According to a survey of election officers report approximately 35% of election officers in 2019 reported voters whose names were not in the National Register of Electors. 35% of poll staff said they sometimes or often encountered individuals asking to vote who were not on the list of electors and who were unable to be registered at the polling station, claimed the report. Approximately 4 in 10 noticed electors whose address did not match the list of electors, while nearly identical proportions noticed electors who had improper ID. So, yeah, do you think that our elections are nice and secure, right, with those Dominion voting machines? I mean, I've got questions. Last tab for this morning, and Brian Lilly says, in response to a question about a 12-year-old boy shot by gang members last weekend, Justin Trudeau promises to get tough on gun control, meaning people already following the law. Read and retweet as I explain how wrong he is. And I'm not going to get into it, but I'm not going to get into that article. But yeah, they use the question and the pointed question of, like, this is your fault. Your lack of action on this directly resulted in, and your enabling of easy release of gun criminals through the judiciary enabled this, like, had this boy die. And he turns it around, Trudeau turns it around and to basically stump speech about his gun laws and his actions on legal gun owners. And that's not the question, but it sounds like it's the question, right? If you're not paying attention, it's the bait and switch. It's the underwear versus the we documents, right? We'll talk around what you want to know about, and it'll placate the majority of the people who aren't paying enough attention to know that I'm bullshitting them, right? Like that's Trudeau's. Well, that's the liberal dance, right? Like the little tap dance they like to do, right? And Mendocino's good at it. Trudeau's, proving to be very good at it. But this is scary because it's not like our government's taking any kind of ownership. They're using this to justify further crackdowns on law-abiding citizens, which won't solve the problem at all, because the problem is being seeded by their bad policies, right? By their inaction, their deliberate inaction, their poor execution of law and order, of rule of law. Everything that they're doing is wrong. Everything. There's nothing that I sit there and say, man, they really got that one right. They hit the right tone there. They haven't done good with the spending. They haven't done good with the job reaction. They haven't done good with the recovery. They haven't done. I mean, this is just this year. Like never mind the bad trade relations. Never mind Iran. The inaction on everything that they've done. Goodness me, what a rant. It's frustrating. It's frustrating when you go to Costco and you get told casually by their little clerk entering the store, oh, your human rights are being dismissed by Costco. Have a good day. Welcome to Costco. We love you. Right? That's from Idiocracy, right? But it's gone the other way. Welcome to Costco. If you don't concede your human rights, you're not allowed to shop here. F you, citizen. And if you don't like it, well, you don't care about your fellow humans. Somebody accused me of not being nice. And I said, well, sometimes it's not important. It's not as important to be nice as it is to fight for your rights. And I mean, maybe you don't think that I'm nice. That's fine. But I have inherent rights, and Costco doesn't get to wave those away with a quick flick of the wrist, right? I've got a great idea, everyone. Let's write a new policy. Right? Like, click, 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 done. Problem solved. Everybody will wear masks and human rights don't matter. Welcome to Costco, Canada. Maybe that'll be the title of my video. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. And have a wonderful, wonderful